role of NGOs in improving the quality of medical services. Across Europe and beyond, NGOs play a vital part in healthcare systems by identifying, strengthening unmet needs, supporting vulnerable populations, populating health education, and often bridging the gap between policy and practice. They are the human link between communities, professionals, and institutions, ensuring that innovation, compassion, and access truly meet where they matter most, in people's lives. In this panel, we'll explore how NGOs contribute to better quality of care, what partnership and frameworks make this possible, and how collaboration between public, private, and civil society actors can build a more inclusive and resilient healthcare ecosystem. I will invite the panelists of today's panel, our guests, to join me here on stage. First of all, I want to introduce Raluca Șoaită. She's architect and founder of Tesseract Architecture. She's here with us. Thank you very much, Raluca, for being here and for joining BEHEALTH this year. Raluca is architect and the founder of Tesseract Architecture, the first studio in Romania specialized in medical architecture. With over 20 years of experience in architecture, she has dedicated more than 80% of her work to medical projects, from clinics and research centers to complex hospitals. Through Tesseract, she promotes a human-centered approach to medical architecture where functionally blends with empathy, aesthetics, and patient comfort. I hope I said it well and I did my homework well. Welcome, Raluca. I will continue with Mr. Ștefan Dabu. He is communication specialist at Romanian Social Development Fund. Ștefan Dabu is a communication and public relations specialist at the Romanian Social Development Fund with over 18 years of experience in communication, media, and project management. Through his career, he has coordinated campaigns and events in the fields of social, cultural, and educational development, collaborating with national and international organizations and institutions. He is also managing partner at cdnews.ro and marketing communication manager at the Smart Projects Association, where he develops initiatives focused on strategic communication and the promotion of civic engagement. Welcome. Thank you for joining BEHEALTH and being here with us today. Unfortunately, Professor Dr. Dan Mircea Enescu couldn't join us. He has an emergency at the hospital, but he sends us his best thoughts, and he's here with us virtually, not on seat, but we hope he will join BEHEALTH for the next edition. I hope we have online Mr. Yves Verboven. My colleagues from the technical team will confirm that Mr. Verboven is with us online. He's the founder and CEO of EU for Health Solutions in Belgium. He's an expert in health policy, medical technology assessment, and market access with over 30 years of experience in the field of medical devices and healthcare innovation. He led market access and economic policies activities at MedTech Europe for more than a decade, contributing to the development of the European framework for health technology assessment and promoting the concept of value-based healthcare. Thank you so much, Mr. Verboven, for being here with us and joining us online today. We are going forward, and I want to introduce you Ms. Ana Mihăiță. She is the founder of SAMAS Association. Health for Mother and Infants is a leading voice. Hello, Anna. Nice to see you again. Ana Mihăiță, yes. She's a leading voice in promoting maternal health and women's rights in childbirth, with over 15 years of experience in advocacy for maternal and child health. She has been actively involved in national and international initiatives dedicated to perinatal care, parental education, and equitable access to healthcare services. She also represents Romania within the International Federation Make Mothers Matter. here. I had the pleasure of meeting you when I worked for the Ministry of Family, and we had some projects in common, and I am very happy to see you here. Anna, thank you for joining us. I'm moving forward to Dr. Vlad Teodor Berbecar. He's the founder of the Doctors Caravan Association. He's a specialist in internal medicine and holds a PhD in medical sciences. I hope he's here with us. Please, I invite you here. He founded the organization during his university years. You can come here near me. Transforming it into a national model for improving access to healthcare in rural areas with 7 branches and over 150 medical caravans organized. He is also the author of the mobile nursing law adopted in 2022, congrats for that, which regulates healthcare services in remote communities. Welcome, Dr. Berbecar. Thank you for joining us. And last but not least, Raluca Chishu, the founder of the Kineto Bebe Association, network of pediatric recovery centers, an initiative dedicated to improving children's health and development in Romania. With over 15 years of experience in management and social entrepreneurship, she has contributed to building a national network of centers that provide specialized supports for children and their families. A graduate of the Bucharest University of Economic Studies and the National School of Public Health and Health Management, she is a strong advocate for equitable access to pediatric rehabilitation services and for fostering collaboration between professionals and parents. Welcome to all of you. Thank you so much. It is an honor for me to be the moderator of this panel. I hope we will, I'm sure that we will do a great job, and we will also be on time, because time is also always a pressure on our shoulders. So I would like to, before I give the floor to the first speaker of today, I would like to remind you that the topic that we are discussing today is the critical role of NGOs in improving the quality of medical services, and the EU for Health objective is access to medical products, medical devices, and crisis-relevant products, ensuring that these products are accessible, available, and also, very important, affordable. So, I will give the floor to the first speaker, who is Raluca Șoaită, architect and founder of Tesseract Architecture. Raluca, you have the floor. I know you have a presentation. I think our colleagues already have it. Please.
As architects, we are like showing projects, and they are very visual. This is why I prepared the presentation. Actually, I prepared the presentation showing 3 projects, but because time is short, I will insist on the one which is very specific to this theme that we have. Mm-hmm. It's the project that it's in Bucharest, Marie Curie, and everybody knows about it. This is the thing that should okay, because it doesn't work. Should I like this or? Yes. Okay. So maybe a few words about us. We are Tesseract Architecture. We are specialized in designing healthcare buildings. Now we arrived at 1.5 million square meters of medical spaces, which says actually that we really do only healthcare. I have an experience of almost 20 years of doing this. And I mean, we concentrate on this. We have experience in Romania, but also outside Romania. We are a huge team. Here are my colleagues, which are architects. We are 22 architects, but we also work with other type of specialists. I mean, we include psychologists, anthropologists, even game designers in our project in order to help us to improve. what we design, and also to address other layers of design. I thought that actually I will say a few words about Marie Curie, but also because we care for the environment, for the social and for community, we also in all our projects we try to have this idea of social responsibility. And here there are two other projects that are very interesting besides Marie Curie. Foshan Hospital, where actually we integrated nature into the design, and this is a very nice topic. And Tecuci, where actually we did a very nice interior design related to Muștar de Tecuci, which remembers a lot about community and how it was before and family, which is a thing that I think is very important in designing healthcare. For Marie Curie, I mean, everybody knows that it's a very nice project that was a lot in the media, and the Ruiește Viață, they raised and they brought a huge community of people who sponsored this project. They arrived to 350,000 people who did it, and I think around 9,000 companies that supported it. They raised 56 million euros in order to build the hospital. They designed it, built it, and now it works. It has almost 1 year of working on it. They did a very nice anniversary, and I will tell a few stories from it a little later. Now we are also working on the second phase, so the project continues. We will add another almost 37,000 square meters to the building in order to move everything that is medical in new building. Okay, so it's very important to say that the project that they had a very special orientation. It was for kids suffering of cancer, oncology department, but also many critical departments that actually supported this. And what they wanted to obtain is a center where everything is treated, where kids are treated for all the type of departments there, from radiotherapy, oncology, surgery, and so on, even ICU and operating theater. What I think is very important to say when we're talking about NGOs, and from our point of view as designers, I think when NGOs are our clients, it's a bit much easier, because at least in this context we had open page, like white page, and we were able to propose and to move a bit over the Romanian, the local standards, and go internationally and look and to propose solutions that actually are respected all over the world, but also do research, which I think is very important when we are talking about designing healthcare, especially for kids. What we did, and it was very interesting, we had a few workshops together with the users of the space, because we think that this is very important. Users doesn't mean only patients. We did also with patients, kids, but also families and also staff. And it was very interesting that we also had anthropologists who stayed in the department for 2 weeks. And that they analyzed the way that the users, they were really using the space. Why we did this? Because, I mean, standards, we know, we work with them for a while. They usually respect technical and functional conditions, but they don't look at the psychological part. And we wanted to see also what are the needs from the psychological and emotional aspect regarding also patients, but families and the staff. And very interesting, of course, kids, they want to play, and the thing that actually the conclusion out of these workshops was actually that they need many activities in order to move their mind from disease, from hurt and so on, even from death to other stuff, so they can be still happy when they have cancer. And then regarding the families, it was very interesting that we found out that many families actually they split in this period, because one of the parents stays in the hospital and the other is at home. Kids, brothers and sisters, also grandparents, they don't see their family member for months. So what we did, we went over and we actually did areas where they can meet during the weekend in order to bring everybody together, connected with play areas in order for kids like brothers and sisters to play there. But also in the same time, there were families who actually they have to work and support their families, members of families that they have to work. So we prepared also areas for parents where they can work, they can socialize, and and they can maybe even take a moment of how should I say, not crying in front of the kid. And also medical stuff, very interesting. We had workshops, and there are many nurses who, and I think this is very important. Many nurses, they don't resist for long in oncology departments, especially for kids, because emotionally is very charged. So what everybody was like needing was support, and we proposed areas for staff where they can come together and they can form a community in order to support each other in this type of moments. We worked side by side with the staff, and we have many ways of doing it in order to make sure that also the functional and technical aspects are driven to the most details. So we use BIM, MIGS, virtual reality, and so on. And mock-ups was very interesting because we made some rooms, typical rooms, during the construction field, and they could see and test everything, and this also helped us to improve with low budget the design of the furniture. Here you can see actually what the anthropologists, they also realized, and I mean during their stay they realized that because many kids are coming, 50% of the patients in Marie Curie, they are coming from outside Bucharest. They come from all over Romania, so they can come with lots of things with them. They stay for 6 months in the hospital, so they have to have everything. So one of the biggest problem from the point of view of epidemiology was that all these things, they couldn't be deposited, and they were all over the world. So what we did, we proposed furniture in order for parents to put everything together, and now they can clean it easier. I told you about the visiting rooms and the playrooms. We created these rooms connected, so during the weekend when the family comes, the kids can play in the other room. We proposed playgrounds, but like with many themes, we had a cinema, but it's not only that we proposed this idea of cinema, but also a program for the cinema and a program for the theater, because now they have theater, they have actors who come, they have they launch movies in here. It's used also for kids that are in wheelchairs, but also in beds, because not all of them they can sit down. Areas, for example, where they can jump and stay together, where they can do stop. Wherever we had a small, how should I say, space that was not used, we added something. You saw before the astronomic observer that we put it on the building in order for them also to have these activities. This type of activity. Here you also have like a terrace that is, how should I say, a playground that usually kids go to during the weekends with their family. We brought it at the 3rd floor so they can go also during the hospital, so they have a connection with the outside. What also we did very interesting related to transplant units, they stay for 2 months. Actually 6 weeks is the minimum. They stay in these transplant areas, and they don't have access to anybody from outside. We put the play areas very close to these transplant rooms in order for them to talk to their friends and to have support during their stay. ICU was also because it was a subject nowadays, and you know, in Iași with all the troubles that happened there, we proposed here, and it was very nice that the staff accepted this, a model which is very interesting. We have an open space for surveillance and one bed unit, in order for each kid to have only one room and to reduce the spread of nosocomial issues. Also having a sink that can be used also, I mean, they are not really using it because they have lots of urgencies, but during an epidemic or so on, they can use it. You have to wash your hands, and the door doesn't open if you didn't wash your hands. I mean, I think in total, and I think it's very important to say that when you have an NGO, I think you dare a bit to do more, to go over the standards, to do research, and to propose things that actually you won't do for normal projects. where money is very important and where also time is very important. And I think this is, from my point of view, the best thing that actually happened for us in this project. And this is why we could do this project that actually now it's a pilot, it's a model to what it happens in Romania. Thank you.
A best practice model, actually. Thank you so much, Raluca. You know, in my daily life, besides my mission at the National Institute for Active Aging, I'm the Deputy Director for the Social Care and Child Protection Directorate, DGASPC, Sector 2. And I see a lot of suffering, a lot of sadness, a lot of problems, and I realize sometimes, not in all times, but at least sometimes I realize how lucky we are to be safe, to feel safe, to have a home, to have a family, to have a career, and to have the possibility of working and of changing someone's lives in a good way. I wanted to ask you, Raluca, if you allow me, as an architect and also as the founder of Tesseract, you've worked at the intersection of design, health, and human experiences, because you spoke about these experiences that you had, especially at Marie Curie Hospital. And I wanted to ask you, what role, from your perspective, what role does infrastructure and design play in making healthcare services more accessible and inclusive for all patients, no matter the age, no matter the social status? What do you think? How do you see it?
It's a very vast subject. Of course, it has a huge role, and I think as architects have this in our responsibility also to make it like this. It was, how should I say, forgotten for a while, at least in the healthcare field, because we insisted, I mean, from the 70s to now, we insisted on this idea of having very functional, very efficient, very technical buildings. And this layer of emotional, of psychological, was not in our, how should I say, in our view anymore. But now, recently, the past years, we see it more and more, and I think it's very important. There are many studies who show this. Also, there is a very nice how should I say, a sort of research subject. We call it neuroarchitecture. It's from, of course, it uses a lots of research already done from neuroscience, and we apply it in, especially in healthcare, where actually I think it's very important to have also the moral very high in order, because this participates to the healing. I think it's very, very important. And when we are talking about this, is not only about this idea of, you know, oncologic patients or patients suffering, but also, I mean, patients with all types of disabilities that actually were not considered. And maybe, I mean, even for example, in Romania, we have these issues with a mother with a baby, and we don't have bathrooms where, you know, you can change the babies. I mean, this is very important, and I think us as architects have a very important role in this, not only to respect the rules, but also to, how should I say, precede them and to propose new solutions in order to address this.
And I think it is also very important to, personally, I believe in the power of ecosystems. I think that we cannot do it by ourselves, NGOs by ourselves, public institutions by ourselves, companies by ourselves. We have to work together and to struggle together sometimes. How do you feel about the collaboration between NGOs and the public institutions from your point of view, or from your own experience?
I think it's very important, as I said. I mean, NGOs, I think in Romania, at least lately, NGOs did a lot in changing the system, you know? I mean, like really huge changes, because these are the ones that count. Romania was in a long period under a system that formed our brains in a certain way, and I think like important changes should be done. NGOs did this. I mean, you can see the Riește Viață, they built a hospital.
Yeah.
They build a model because they trusted, that they can do this. And because I forgot to say, this is very important also because we are going back to our projects. We are going back to our projects to see how the users, they use the space and if all we propose, it's okay. Because maybe sometimes, it's just testing. When you do research, you don't know exactly what you will obtain. And it's very interesting that actually it works. We had this, two stories are very nice in the anniversary of 1 year of using Marie Curie. One with a kid who was crying. She didn't want to leave the hospital because it was too nice to be there. So actually she didn't want to go home. For us it's very important to hear this because this is one of the main scopes that we had in designing. And then another one from the ICU medical staff, and actually the chief of ICU, they were very implicated into the project. We designed all the drawers together with them. He said something very nice that, when we were little, we were hoping to go outside Romania because it was very nice to go in străinătate. And he said that actually every day now he goes in străinătate going to the hospital. I think this is very important also. So it's important to do research. It's important to try to move the standards, to move them all the time a bit in the future, and then to see if this works. Yeah.
Thank you so much. I have nothing to add to this. I will move forward to Mr. Ștefan Dabu. Mr. Dabu, you have the floor. We are looking forward to listening to your presentation.
Ladies and gentlemen, my name is Ștefan Dabu. I'm very honored to be here, and I represent the Romanian Social Development Fund, a public interest organization that has been supporting vulnerable communities across Romania for 28 years. In the past 7 years, through the local development program, funded by the EEA and Norway grants, RSDF has supported over 100 projects, improving the living conditions of thousands of people. Among them, 35 projects were implemented by NGOs. And this is important because, as you said earlier, NGOs are often the ones closest to communities, especially where access to health, education, or legal support is limited. Today I will present how several NGOs projects funded by the RSDF have contributed to improving access to health services in vulnerable areas, from community-based palliative care to integrated health and social support for Roma communities. Among the most relevant program achievements, over 25,000 disadvantaged persons received social services, more than 15,000 children and youth were supported to remain in school, while nearly the same amount of Roma people accessed integrated services such as legal, social, educational, and health support. These figures clearly show that health has been a key area of intervention, especially in communities with limited access to medical support. To illustrate how NGOs have contributed to this change at the local level, I would like to start with a flagship example. PAL Community is a project developed by Hospice Casa Speranței to address one of Romania's most pressing gaps, access to palliative care in rural and underserved regions. And the project created an integrated model that brought medical and psychosocial support closer to people living with severe chronic illnesses. Through this model, the project tested community-based palliative care services across 6 counties, targeting both adults and children, while also building professional capacity and raising awareness among local institutions. What truly validates this intervention is its reach. More than 1,500 patients from nearly 300 localities received care supported by newly established home care teams outpatient clinics, and a 24/7 support line. Beyond immediate service delivery, the project ensured long-term impact by training over 180 professionals and developing a policy proposal that can support the expansion of palliative care at national level. A different but equally impactful approach comes from a project led by Roma Center for Health Policies, SASTIPEN. Unlike a specialized medical intervention, this model addressed health from a broader community inclusion perspective. The project targeted rural Roma communities where lack of access to healthcare, identity documents, and legal housing often leads to a cycle of exclusion, poor health outcomes, and limited life opportunities. To break this cycle, the project established 3 community centers providing integrated health, legal, educational, and social support in close partnership with the local authorities. Health services played a central role, from primary consultations and screening campaigns to monitoring pregnant women and newborns, encouraging vaccination and facilitating registration with family doctors. But the intervention did not stop at service delivery. It empowered community members, promoted civic participation, reduced discrimination, and led to the creation of 3 local NGOs to sustain change beyond the project lifespan. The 2 projects examples, they are very, very good and important, but they are part of a broader ecosystem of health-oriented support projects supported by the program in collaboration with both local and national partners. This includes projects implemented by organizations such as Romanian Red Cross or the National Institute of Public Health, all working with local authorities to improve access to prevention, primary medical services, and community health support. Together, these NGOs-led interventions have demonstrated that when funding community trust meet, health services can reach people who were previously invisible to the system. Thank you for your attention.
Thank you so much. It is very clearly that social responsibility in health is not just about funding hospitals or building systems. It's about showing up for people, actually. It means understanding that every action that we take, every choice that we make as individuals or as professionals can make the difference in someone's life, transforming it in a better one, or no, but hopefully in a better one. I want to ask you, Mr. Dabu, I wrote here a question for you, because I want to find out, in your experience, what makes the difference between a successful NGO project in healthcare from those projects that struggle to create lasting change. What do you think is the secret for an NGO to have successful projects, at least in healthcare, because it's a very sensitive subject?
Yes.
And it's very difficult to make the difference, no? When we speak about the healthcare system.
It depends of the community's needs that they are addressing, because sometimes a bigger NGO is working very, very good for the people. Sometimes a small NGO in grassroots work does a better job. Mm-hmm. So they must, I think, from my experience, they must identify very, very good the needs that they want to address, and then to be connected to those people that they want to help because if only their work is theoretically, or they don't connect to the ground with the people that they want to help, it's very hard to make a change, a real change, or to have an impact.
True. Thank you so much. Sometimes people ask me which is our secret, because we have more than 40,000 members at the National Institute for Active Aging, and we founded the Institute just only 5 years ago. And I always answer that our secret is creating communities, because people need boundaries. They need to be part of something bigger than them. And I think, yeah, your answer is very good. Thank you so much.
Thank you.
So we are moving forward. Mr. Verboven, is he with us? Yes? I would like to give you the floor, Mr. Yves Verboven. Do you hear us?
I can hear you very well. Can you hear me
Okay,
as well?
thank you so much. You have the floor.
Well, thank you very much, and thanks for the invitation, and also to be in this distinguished panel. And apologies, I cannot be here with you today. I was there on Monday, and it's really a pleasure to also introduce the consideration with regards to how medical technology innovations can also greatly contribute to the social responsibility in health by means of improving the access, the quality and the equity in healthcare, and this while all promoting the well-being of individuals and the communities. And I like to provide a couple of ways of how, by use of medical technology innovation, we're seeking to actually contribute. I think a first element is the ability to improve the access to healthcare. And so innovations, as we currently increasingly see as the remote monitoring, the telemedicine, mobile health apps, allow people in rural underserved areas and remote areas to also receive care without the traveling of long distances. Example is a telehealth platform that can connect these patients with the specialists in the hospitals, reducing the inequality in access to care. And so what I understood from the presentation on Monday from Minister Pislaru, that in Romania, the aim is also using the structural and cohesion funds to build out new hospital infrastructure. It will be important to ensure also this inclusion of these remote innovative solutions to offer the expertise and also the ability for personalization for the management of, for example, chronic diseases. It's something that we are just starting up also in Flanders, where I'm living, where we have signed new conventions, where this is becoming part of the healthcare organization. And we started this for the field of healthcare management and also remote rehabilitation. Also, I noticed in other countries that pathways are being set up, like in France, in the Netherlands, for the assessment of those novel innovations before ultimately they're being implemented. But so it's certainly a way, I think, how technological innovation can contribute. Another area is the area of enhancing the quality and the value of care. Therefore, for example, thinking on AI-assisted diagnostics, robotic surgery, electronic health records, with the data space which is further evolving, enabling to improve the accuracy, reduce the errors, streamlining the care delivery. Something an example there, what I picked up from a recent development also in the context of EIT health, is the ability, for example, to have a diagnosis, an early diagnosis of diabetic retinopathy, which is something that can be done in standard opticians services. So it will also help in that very early diagnosis, and in that way ensuring a quite timely access to the care and providing then the appropriate quality and value of care. Another element where I see the medical technology innovation ability is the reducing of the health inequities. I think when we're designing ethically and affordable technology, we can help to ensure this more equal access. I think example is diagnostic tests, but also like an example what I picked up out of India, where you have, for example, smartphone-based ear infection controls that are being done, which will actually allow to have an appropriate treatment very quickly in children, avoiding the further hearing disability, which is then jeopardizing the further learning. So I think these medical technology innovations allow also the area of empowering patients and communities by means of wearable devices, health education apps, online support platforms, which allow people to take more ownership of themselves, of their health. And so what I understood is that there's also a focus area within Romania on focusing on assistive devices. This is also then an ability to get a quite improvement in the value of care, and in that way also in the social responsibility. There are others that are focusing more on the public health, on prevention areas, also on the promoting environmental and social sustainability. It's certainly an area where increasingly we have a European frameworks which are being put in place to do that, but also a specific focus of innovators of these medical technology innovations to ensure that we're not only looking at the patient care, the healthcare, but also that we look broader at environmental aspects, and in that way also have a further reduction in the overarching carbon footprint that we have. And finally, I just wanted to bring forward the area that we are taking this also quite as a focus area to encourage an ethical, evidence value-based development of innovation, so that ultimately we can have economically most advantageous solutions, which are then going to be accessible much more broadly. And so in summary, I think that I just wanted to highlight that this area of medical technology innovation can certainly be a major contributor to the social responsibility in health.
Thank you so much. It was very very interesting what you have said, and also maybe can you answer a question that I have in mind? In what ways can partnerships between NGOs, healthcare professionals, and EU programs like EU for Health accelerate affordable access to crisis relevant medical devices and also treatments?
I think it's indeed quite critical to have this working together in having different cornerstones. It's a combination of from one end the initiatives that are being taken by the NGOs. By the initiatives which are also were mentioned by previous speakers, and then to take into consideration also how technological innovation can be supportive in that field, and I think this combination will be critical in order to ultimately get the well-being of the patient and of the society. So I think it's quite critical to have this cooperative, this partnership, while we're connecting up also the technological innovation ability with the drive that the NGOs are having in order to address the needs that exist.
Thank you so much. We hope that you will remain with us until the end of the panel. Your work is very important, and I truly value it. And again, we are very happy that we have you here at this panel. I will
It's been my
go
pleasure.
now. Thank you. I will go now to Anna Moiță, the founder of SAMAS Association, Health for Mother and Infants. Anna, you have the floor. Thank you so much, and I am looking forward to listening to you.
Thank you. Yes, I've just realized that I've been not exactly a hell raiser, but more likely a troublemaker for the Romanian healthcare system for almost 20 years now, because my eldest son is just turning 18, and that's about when I started to make trouble for the Romanian healthcare system, when I realized that I was going to become a mother. I was quite young for my generation, not for, let's say, medical recommendations for pregnancy and childbearing, which usually are lower than 30 years old. So if we have any young ladies here, please make babies until the age of 30. It's best from so many points of view. Mm-hmm. I was 25 when I had my first child. I was 24 when I became pregnant, and that's the moment I realized that in Romania there are some very surprising problems, even for urban women, women with a good level of education, good level of access to healthcare. But again, this was 18 years ago, 19 years ago almost. So from that moment on, when I realized that even for a woman who technically had all the aces in her sleeve, I was young, I was healthy, I had access to healthcare, I had financial means to access any type of healthcare, even though back then, yes, there was no private hospital maternity still in Romania. The first private network, medical network in Romania that opened a maternity actually did it the very year I was pregnant. So toward my third trimester, you must remember CMU, Centru Medical Unirea. They opened the first maternity, private maternity in Bucharest and in Romania. But when I realized that there were so many problems that were not caused by healthcarers not wanting to provide the best healthcare for women, but rather from systemic issues, I decided that someone has to speak up and to do something about it. So from that moment on, I made a U-turn in my career. When I'm not Batman, when I'm Bruce Wayne, when I'm not an advocate for, it's called, because it has a there's legal jargon for this. It's an advocate for human rights in childbirth. This is a legal special category, human rights in childbirth. So when I'm not an advocate for human rights in childbirth, I'm actually an interpreter, translator for Neo-Greek language. So you must imagine how steep this U-turn was for my career. I became an advocate for pregnant women and mothers all over Romania, requesting better care during pregnancy, childbirth, and the very important months after the birth of the child, through a series of NGOs that I created, Mothers for Mothers. It still exists. It's an advocacy vehicle. We change legislation through it. the White Cross Foundation. It's again a Romanian-based NGO focused on the safety of children in all their dimensions, safety from verbal abuse, physical abuse, sexual abuse, safety during traffic, and of course SAMAS Association, which is an acronym for Sănătate pentru Mame și Sugari, which was created by a consortium in 2015 after we had a very successful pilot project modeling a type of intervention that blended education for mothers-to-be and new mothers with support services from certified healthcare providers for parents-to-be and new parents, because yes, men are also included in this very beautiful journey of baby making and child rearing. And this is when I'm going to refer to what Raluca said earlier, that it is so important, and very few people realize that it's so important to be aware of how the environment in a hospital impacts the experience of childbirth. The placement of a door is so important, and unfortunately still in Romania, most consultation offices have the door placed directly in front of the consultation bed. Imagine being a woman on the consultation bed with your legs spread wide and your nether parts face the door. Anyone who opens the door sees you in your most vulnerable position. It's so simple to change the position of either the door, either the bed. Put it sideways, place it sideways. Protect the patient's, the woman's dignity by such a simple change. It doesn't cost anything. You just have to consider a woman's dignity and her position during consultation. Yes, if a door can be so important and it's just a door, SAMAS also found a very simple intervention in the community by means of a very simple object, a cardboard box, a literal box made of cardboard. It's about this big. Usually we store, I don't know, winter clothes in them or shoes, old shoes. But no, it's a very important box because it's a box inspired by the Finnish baby box program, which is almost 100 years old. It was implemented by Finland in the 1930s when they realized that they had a problem with child mortality, infant mortality in the first 12 months of life after birth. And the way they intervened to improve child survival rates in the first 12 months of birth was to gift each and every mother, irrespective of her social financial status, this cardboard box, which was also fitted with bedding. It could be used as a safe bed for the child until the child turned 3 to 4 months old. It was filled with objects and care products necessary for the child care during this period, so hygiene products, clothing, special scissors for trimming the nails of the baby, over 50 products. They were not cheap products, but they were quality products. Each and every mother in Finland got the baby box. And in less than a decade, they managed to decrease infant mortality by a staggering 80%. So it works. It still works in Finland. Countries that had the problem of infant mortality brought the program to their communities, and Romania did it in 2016 I remember when Finland, and there was the ambassador of Finland presenting the program, I went there, I researched each and every object that they placed in the box. I asked about the box dimensions and safety guards. And in 2018, SAMAS, the association, launched the baby box in Romania. We did it with a very small financing, but we managed to really implement the program in Romania with a very important twist that we also learned from Finland, because what the Finnish experts told us was that the box was just a hook for accessing mothers and making mothers come and take the box. And when they come and take the box, healthcare providers provide and deliver child-rearing classes, breastfeeding support, educational services, which are very important if you have a newborn at home. Of course, we realized that this was the most valuable add-on to the box. This was actually the intervention, the education. Because I don't know if you know this, but free life skill education in Romania is the most difficult product to sell. It's almost impossible if you deliver and offer free classes for pregnant women, for parents. I teach, for example, a safety class for dads, young fathers who have a baby and a toddler at home. You need to learn how to baby-proof, toddler-proof your house, so that you can prevent the major risks for sleeping, sudden death during sleep syndrome, falling outside the window. So there are all kinds of risks. You know them, unfortunately, in Romania from the 5 o'clock news. There are still children in Romania dying from 100% preventable risks. But offering these classes for free is a very difficult product to sell. So you need the hook, and the baby box is actually the hook. In 2018, we partnered with OMV Petrom and Save the Children, and we've been doing the baby box program in over 20 counties in Romania, and when I say counties, I mean județe, so almost half the country was covered by the extensive baby box program with our partners Save the Children and our supporters OMV Petrom. The numbers that made us realize that we really need to scale up the project were horrifying. So a baby dies in Romania every 10 hours from preventable causes. So an infant under the age of 1 dies every 10 hours in Romania. 8 in 10 mothers during our impact study research told us that they wouldn't have been able to buy the products that we give them inside the box. Of course, we target underprivileged communities, rural communities especially, with very little access to healthcare providers. And again, this is where the true value of the box really revealed itself, because with the box, we managed to empower community nurses and midwives. There is a national network of community nurses and midwives in Romania. Unfortunately, they're really overlooked by, let's say, the system. They have very little support, financial support from the state. There are really hardworking healthcare providers who do the groundwork, really go from house to house. They get to know the family. They go with a box. They gift the box. They instruct the mother on how to properly use the box. They deliver the class and the support services, and they keep in touch with the mothers even after the box becomes obsolete from a bed point of view. It becomes just a box after the baby outgrows it. But the fact that they had gifted the box really cements the relationship between the mother and the healthcare provider. And our impact study again showed that more than 96% of mothers really improved their child-rearing skills. Breastfeeding rates also improved, and a very, very important marker that we are so happy with, vaccination rates improved, which is great. I don't know if you know this, but vaccination rates in Romania have plummeted. Unfortunately, the rate of patient trust in the immunization concept as a whole has really shot up with all the conspiracy theories, with all the let's say, disappointments from the public medical system, healthcare system. There's a really high rate of vaccine hesitancy. And yes, there's also lack of access. Family doctors' numbers are dwindling, so it really takes a parent some effort to go and to register the child with a family doctor or with a pediatrician, and to really keep close and follow the vaccination scheme. The baby box managed to improve that. So you can go on our website. We also had a small video, I think. No, you didn't get it. It's
we
fine.
are also pressured by time.
Cutiabebelușului.ro. I'm here for any questions that you might have. Cutiabebelușului.ro, you have all the info there. And we are open to collaborations, new ideas that might positively impact our work on the ground. Thank you.
Thank you so much, Anna. It was very impressive, and your work reminds me that healthcare is not only about buildings and about technology. It's all about human connection and about being there in the right time with the right information for all the people that really needs it at that particular moment. And I have a quick question, and I will ask you to be very short in your answer, but precise. Can you tell me how can public institutions learn from SAMA's model when it comes to integrating prevention and education into national healthcare policies? I know it would be a long answer, but I would ask you to be short, please.
So the very short answer is that we did work with the Romanian Parliament to create and pass legislation to transform the baby box into a state program, nationwide program. We worked very hard for over a year with a number of Romanian ladies, from deputies, from the MPs, from the parliament. Unfortunately, when they realized the complexity of the logistics of the program, they gradually started to amputate the legislation until our baby box became a voucher. So that's the baby box with the education attached to it progressively got amputated from a legislative point of view, and it became a voucher. It's not the intervention that will make a change in disadvantaged communities for mothers and babies. I'm sorry. The voucher is, I think it's still on, but it definitely does not make the change that the box can make.
It doesn't respect the main idea.
No, unfortunately.
It's just a financial support, I think.
It's a voucher, it's money that you get. You technically are limited in the variety of products that you can use the voucher for, but it's not the baby box. It will never have the impact of the baby box. So that's it.
Thank you so much, Anna. We are going forward fast forward because the gala is coming and we don't have much time at our disposal. I will continue with Dr. Vlad Teodor Berbecar. I remind you that he is the founder of Doctors Caravan Association. Thank you so much, Dr. Berbecar, for being here. I truly admire your work and I'm looking forward to listening to you. Thank you. You have the floor.
Thank you. So I'll be short. I'm going to tell you about the Doctors Caravan Association, what we do, how it started, and how it's going. So we do caravans. We started in 2014 based on the idea, the fact that there was poor access to healthcare, especially in rural communities, but not only. Over 90% of medical infrastructure and medical professionals are located in the urban setting. We try to bring healthcare services where it lacked. We started with the rural communities, now we go even in the urban setting because even there are vulnerable people and people who lack the education or even the access to healthcare services. So we started doing caravans. We started bringing healthcare services, advanced healthcare services like blood tests, EKGs, medical examinations, ophthalmologic examinations, ultrasounds. We created different types of caravans because it's difficult to, you have to have a separation on stuff like adults and children, so we created pediatric and adult caravans. And we also created women's health caravans because it's quite easy and quite important to do screening for women's health, and it's easy to do pap smear and breast ultrasound in a country that has the highest incidence of cervical cancer. We do a lot of activities now. We try to do medical educations. We try to improve healthcare and bring healthcare services in places where you can't create, there are still places where you can't create clinics or hospitals. It just isn't feasible. So mobile healthcare is a concept that works, and it worked really, really well. We created, in the last 10 years, we organized over 200 caravans and examined, gave free medical services to over 20,000 patients. We expanded and created branches in all around Romania in the main regions so that we can improve healthcare to the Romanian population. We also have a really important digital component. Everything we do is digitalized, and this is also an important aspect. And our biggest achievement is the Mobile Healthcare Act. We, after having such good results, we try to transpose everything that we do into legislation, and we managed to do that. We created the Mobile Healthcare Act, which basically allows any medical institution or clinic or hospital to do mobile healthcare, to do caravans. It's a new paradigm of medical services to bring medical services closer to the people, to do periodic healthcare screening and checkups. It's something that, this is what we tell our patients, that everybody should do a medical checkup once a year. We have patients, we did a study in our caravans on over 500 people, and 10% of them had never been to the doctor, had never had their blood tests drawn, and the median age of the population that we examine is 55. So we're talking about elder people who have never been to the doctor in their lifetime. So this is what we try to promote. We try to promote the concept of periodic checkups and the concept that anybody should be proactive and go to the doctor not just when it hurts or sometimes when it's too late, but to do a regular yearly checkup and regular screenings. So this is my presentation.
Thank you so much. You are fast,
yes.
As you said. But your work is very impressive. And I was wondering if you can tell me what challenges have you encountered in bringing medical services in this remote and mainly underserved communities. I imagine there are a lot of
challenges. Firstly, from convincing the local actors, and I'm talking about the local administration that has to somehow accept these events, to convincing people that they need to do medical examinations and regular checkups. And we actually have a lot of cases, and we had an incident that was just after the COVID pandemic, where we wanted to do a normal caravan, and we went there, and nobody showed up because somehow a rumor had spread it that we were there to vaccinate them. So we have a lot of challenges to overcome, but we try, and so far we have managed really well.
Thank you so much.
Thank you.
Thank you. What keeps you motivated?
So some of the pictures here keep me motivated. The impact that we have on the community is extraordinary. And this is, I think, one of the most important things that you can give back to the community. It's a better and healthier life.
Thank you so much.
Thank you.
Before I give the floor to Raluca Chishu, because I like this particular question, not that is mine, but I would like to ask each of you if you can give me a quick but very, very short answer at this question. What keeps you motivated? Just a quick question.
I already answered to this question. You know, these stories when actually what we do works, and you see kids that are happy in the hospital. For me, this really motivates me. Yeah.
Thank you, Mr. Davo.
I think it's wonderful for each of us when we see the results, when we see the impact on the lives. It's what is the best thing ever. Thank you.
Thank you, Anna.
Seeing babies thrive and not die from causes that used to kill babies in the Middle Ages. I really believe that babies deserve every healthcare advantage of 2025 in a European country. So that's simple.
Thank you. And the parents deserve the support in having babies, because I remind you that 1 out of 5 couples in Romania are dealing with infertility. I know this because I coordinated the IVF national program at the Ministry of Family for 3 years. And we have the lowest natality in the last 100 years. So Raluca Chishu, the founder of Kineto Bebe Association, maybe you can start with the answer at the question, what drives you, what motivates you, and then of course you can continue with your presentation. Thank you.
Thank you very much. Of course, I have a promise that I have made it to myself many years ago. When I returned in Romania, I know that here in Romania, for doing good is no limit. So if you believe in no limit in doing good, nothing is in front of you. And I have here in the room at least 4 persons that learned me this rule and this promise, made it real, and Anna is one of them. Yes, Kineto Bebe is a promise that I have made it to myself because Kineto Bebe started in 2009 when the last place for children that was owned from the state was closed. The children that had disabilities and neurological problems, you know, they were taken away from the families and put somewhere, nobody to see them. And we started with a rehabilitation center here in Bucharest for children, and we promised that it will never happen something like this in our country. So in Kineto Bebe, yes, children are first. And we can say this because over 25,000 children made their first steps and told the first word in Kineto Bebe. Over these 16 years, we grow with different therapies, we grow with therapies that weren't here in Romania as a school, as a university, as a measure of dealing with children with disabilities. And this is why over the years we can say that in our centers now we have 4 pediatric recovery centers. We have all therapies that are legally thought for children and therapists that can do this, because in Romania, as you know, there are no schools, no university school for osteopathy, for example, or for sensory therapy. So we have therapists that learn in other countries and are here now to help the children. What we are doing, we are working each day with 250 children a day in our centers, with children from 5 days old to 18 years old. We are working as a voluntary with children in hospitals, there where the parents cannot come with children in rehabilitation centers. And we are speaking with parents at phone there in towns where no pediatric therapist is. So we have in Romania 1,000 physiotherapists for children, for an example, and 1 of 4 children after the birth need a therapist, a physiotherapist by their side. So you can imagine what a lack of therapists and therapy is in Romania. What we are doing in our centers, we are learning together with the children the first steps. We are learning together with the children the first movements, the first words. But only 10% in Romania, 10% from the children that need therapy can access therapy. Because of the lack of therapy centers, because of the lack of therapists, but also because of the financial problems for the parents, because one child needs so many therapy sessions, so many hundreds of therapy sessions in a year, and the states give them only 20. So the rest of the therapy session, the parents must pay, the parents must go in other towns to do it. So one of Kineto Bebe's health initiatives include the therapy grants. And the therapy grants guaranteed to the children the therapy. So we offer last year over 10,000 therapy sessions, free therapy sessions for children. And we are offering more therapy sessions at the National Institute for Rehabilitation. So I am saying again, and what Anna also said, the NGOs are doing more than the states. One of the other programs that we have is #StageRep. This is a posture program that promotes healthy habits among children. Why? Because we see in our rehabilitation centers that children with 7, 8, 9 years old are coming in our centers and they have back pains. Back pains because they stay at home on little digital devices, or at school they don't make the normal sport session hour. So this is why we are going in schools with physiotherapists. We are speaking with children, with teachers. We see that in so many cases teachers don't learn the children how to stay in the bank at the table, so what they are learning is not correct. And we try to build a bridge between children, teachers, parents and physiotherapists, so we prevent further orthopedical diagnosis. Why? Because the pain that the children feel can be the first sign of something to take in order, and the parent to go to the doctor. But until they don't know how to say it, the children cannot say this to the parents. This is why we are learning this thing with them. Together with my colleagues, we try to give the children with disabilities also the right to a childhood. They have the right to education, they have the right to health, they have the right to do everything what with health and education together is bounded, but also they have the right to be children. And the right to be children, this means that they should go to a concert, they should go to a museum, they should go in places where also other children go. And they don't have this possibility because they are disabled. They don't have the way to go there. They don't have the parent who support the child to go there because the parent has to work. And also we don't have institutions that accept these children. So this is what Bucharest is also theirs. This is a program that helps children, disability children, to be everywhere where a typical child is. We need your help as a community, because we are doing this as a community to improve access for these children to rehabilitation, to educate the professionals, and also to expand their rights to be children. You know what motivates me? Me motivates people that are not in their phones. Me motivates people that are not with the eyes only on scrolling. Me motivates people that are active, present, alive. We as NGOs, often when we speak, everybody thinks that we want money. Of course, we need money. We don't want money. We need money to make these things that you saw today, that we are doing hospitals. We are doing medical care there where nobody is doing it. We work with children there where the state puts the children away. And we are making this community alive. So please, dear sponsors, don't scroll us. Just listen to us, because we can be your chance to live. So this motivates me.
Thank you so much. What is the change you want to see in Romania?
The change that I want to see in Romania is, I don't know, more flexibility from the financial part and the legislation part. And not to, I don't say this because we want not to be ruled by rules, but it is not possible to speak with local authorities and they only to close our projects away, only to close our ideas away, only to shut the beneficiaries away. More flexibility, more people with whom we can speak, and also why not rules for the social part? This is also something that I want to see, and the healthcare that is, I don't know, a healthcare system that is done for people by humans.
Thank you. Thank you so much. Because we are heading ourselves to the end of the day and also to the end of the discussions in the panel. We don't have time anymore, but I would like, even if they don't invite me next year to moderate, I would like to, I'm joking, I would like to have at least one question from you guys, if you have something in mind, if you want, just one. We apologize for that, but it's getting late and the gala is coming. So I know you have to, some of you at least have to be there and you need time for that. At least one question we can take from the audience. If somebody wants to add something or to ask somebody something, this is the time, or if not, we can do that afterwards when we officially finish the discussions. No? Nobody? Okay, please.
The comment to the fact that the NGOs, I think, took the responsibility or took in their responsibility some of the activities which should have been carried out by the state. Without you, without the NGOs which works in social care, healthcare system, I think a lot of bad things will have happened in our country. You are good examples, best practices, the best practices I have ever seen. So congrats to all of you. And thank you for existing.
Yeah, they deserve.
Make a small addition to that. I don't know if you know this, but you probably saw it on TV, the terrible explosion that took place in Bucharest. The building blew up from gas accumulation. I don't know if you know that the Bucharest municipality went on social media with a public appeal for donations and help from the NGOs for clothes, for housing solutions for hundreds of people who are left without a home. This is the social, the civil society in Romania. It's the superhero that has to come and help the state. I'm not proud of that. This is the other way around.
I think they are
We
not
do it because we
either.
have to do it, because there's nobody doing it. And this is not right.
Thank you so much. Thank you everyone for this inspiring and deeply meaningful discussion. I was honored to be the moderator of this panel. I agree with everything you said because I have always been the ONGs, I don't know how to put it in English. ONGistul de la stat, you know, because I had a daily job in the public administration, and in my spare time I tried to be an ONGist, and I know that I have this frustration all the time because the NGOs have to be there when the state fails, and it's very difficult because you actually have to be the superhero, as you very well said it, Anna, and it's not fair. It's not fair, but I have hope because I saw a lot of young people in the last years, at least, going or choosing to work in the public field, and this gives me hope because I saw them at work, and I saw them coming with new ideas, with visions, with role models, with best practice models, and actually succeeded in implementing these models from abroad, from whatever, but models that works for others and for sure will or should work for us too. So I think in the next years we will see some real changes in the public field because new generations are coming and young people are coming with other habits, other visions, other inspiration and motivation. Thank you all. Thank you. Thanks to the audience. And in the end, before we close this panel and the day, I would like to thank Flaviana again for choosing me to be the moderator of this panel and also for gathering all of us together. She created an ecosystem, like I like to say, and this is very important. I truly thank you, Flaviana, and congratulations for organizing BEHEALTH this year, as in every year. Thank you so much. Thank you, all of you. Thanks to the technical team.